I want to veer off a little bit because this is really important. When you're choosing goals, you need to choose goals when you're working with insurance that address medical necessity. Insurance plans only pay for sessions that they believe are needed. So due to the Federal Parity Act and Affordable Care Act, most clients now, they have unlimited sessions regardless of diagnosis. Unlimited coverage for their sessions. Some plans have a little exceptions, but for the most part, regardless of their diagnosis, your clients have unlimited sessions. But health plans can still refuse to cover visits that they feel are not medically necessary. And if your treatment goals are not medically necessary, they could refuse to cover your client's sessions. So they both do medical necessity reviews where they call you up and do a clinical review to see whether they think that treatment is needed. And that's true even for those of you who are out of network therapists, that you haven't signed a contract with an insurance plan, but your client turns in a statement or a super bill to the insurance plan. So they still can review your care, like I said earlier, and they still can look at your treatment notes and your treatment plan and see whether they think that the care is addressing something medically needed. So your treatment plan and notes must address medical necessity. And that's why I want to spend a moment talking about this, because it can be critical. Again, if your notes aren't great, see my progress notes webinar, which is on, the link is on our landing page at theinsurancemaze.com/BG. All right. What are health plans looking for in your treatment plans and in your notes? What is this medical necessity criteria I talk of? Well, they want to be sure that you are treating some kind of a DSM diagnosis. And usually a Z code, those things that used to be called V codes in the old DSM, can't be the sole or primary diagnosis. So a person who's coming in just for personal growth work, or a parent-child problem, or a marital problem, and there's no anxiety, there's no depression, there's no higher diagnosis, that may not be enough for them to seek. So all they got is a Z code. That may not be that they can't get reimbursed by the insurance plan. Now, adjustment disorder is usually fine, usually covered by insurance plans. But again, you need to document the need for treatment. If you're giving someone an adjustment disorder with anxiety, somewhere in the notes and in the treatment plan, you want to be addressing that anxiety. They need to feel that the treatment is necessary, not just desired. So in your notes and in your treatment plan, you need to show it's not just personal growth oriented. And the treatment goals cannot just be personal growth, like self-esteem, self-confidence, feeling awareness. So client wants to be more in touch with feelings, would not be a treatment plan that they would pay for. Improve sex. Sometimes they'll pay for that one, sometimes not. Overall, I would say not. Occasionally they will. Better relationships or communication. That's okay if that's the main focus of your, but if there's no anxiety or depression or adjustment disorder, they're not going to probably pay that. So you're always going to want to look for the diagnosis. If it's just career growth, improved life satisfaction and meaning, again, if that's all there is, but you still need to do a treatment plan. But if this is an insurance case, you're going to really want to step up your treatment plan and address diagnoses. So the goals for when they're looking at medical necessity criteria, they're looking to, that your goals need to be about improving functioning and reducing symptoms. They have to think it's the appropriate frequency, and they have to see that the symptoms are somehow, even lightly, impairing the client at work, at school, relationships, health, sleep, financially, and you should be recording how that's happening. And your treatment plan can address, how you want the symptoms to stop impairing the client.